Have you ever felt unusually cold or hot or even feverish after a concussion? It may seem odd, but many people experience really strange temperature fluctuations after a concussion. In this video, we're going to explain why that happens and what you can do about it. Your autonomic nervous system, or ANS, has two separate branches, the sympathetic branch and the parasympathetic branch. Often in a concussion, there can be an imbalance in these branches. The sympathetic branch can control things like breathing or heart rate, blood pressure, even body temperature. So this is where the dysregulation of body temperature can come in. With dysregulation of the sympathetic nervous system, patients can often feel really hot or really cold or even feverish after a concussion. After a concussion, the brain can actually go through some swelling, and this swelling or inflammation can be the body's response to that injury and can be part of that healing process. However, that inflammation can cause body temperature dysregulation and lead a person to feel warm or even a bit feverish. So there are some things that you can do at home to manage these temperature fluctuations. For example, if you're feeling really cold, you can try to get an electric blanket. You can try a warm compress. You can just try to bundle up and wear heavier clothing. However, if you're feeling more heat or more warm, you can try to wear lighter clothing, maybe even turn on a fan, trying a cold compress. Really, it's about trying to affect change in your environment to make you feel more comfortable. But you should always remember, if you are having a fever, you should track and monitor that fever and take your temperature regularly. If your fever is consistently high, let's say over 101 degrees, and it's not going away, it's persistent, it's probably time that you should consult your doctor, especially if this high fever is accompanied with other worrying symptoms like confusion or severe headaches. So these temperature fluctuations after a concussion can be totally normal, even though they can be concerning and unsettling. Feeling too hot or too cold or feverish after concussion is not uncommon. And I hope that you got some good information about how to deal with some of these symptoms from the information provided. For more guidance, please feel free to check out our blog.